Today, what I wanted to talk about was obstruction versus restriction lung disease. Now, that kind of sounds like a lot, but I kind of wanted to first break it down with what lung anatomy is. And I'm not going to go over all of the lung disease, but I'm just going to go over the basic lung diseases that I feel like you should kind of have an idea about. This video is just going to cover the obstructive diseases. The obstruction happens in the small airway. Obstruction, the definition is, well, it's obstructed, and usually it has to do with the airflow. And the obstruction happens in the small airway. Air just cannot get out, which causes wheezing. And so that's basically what obstruction is. And with restriction, it's not able to get in. So in this video, we're just going to focus on the air not getting out. Now, to focus on this, I first want to bring the attention to this diagram that I have here. This image will be very beneficial for us to understand first what is lungs. Obviously, there's a lot of things going on. Anatomy points, I feel like, are where the foundation is set. Oxygen comes from here and it goes all the way into your lungs, and then CO2 is released out of your mouth. So oxygen goes in, CO2 is released. This process is actually called inhalation or inspiration versus exhalation or expiration, whatever you want to call it. So when you bring the air in, what tends to happen is there's right here, they don't have it labeled, but I'll just draw it. Right here is the diaphragm. Right under the heart, we have the diaphragm. And so when the air gets in, the diaphragm moves down. So you see the diaphragm is moving down because the lungs are expanding. So because of that motion, the diaphragm is moving down. At the same time, what's happening is, I'll draw an arrow to illustrate this, but your lung volume is actually increasing. So I'll just show it with an arrow. And your sternum is actually going out of your chest. This is a very automated process. That's what happens when inhalation is happening. The exact opposite is happening when exhalation is happening. I'll draw another arrow. So this arrow right here is showing that the lung is constricting back again. And at the same time, the diaphragm is moving back up into its normal position. I wanted to talk about this right here, this photo. You're probably wondering, what is a bronchiole? This is a bronchiole right here. And in your lungs, you have the main airways, which are called the bronchi, which branch off into smaller passageways. The smallest airways, which are called the bronchioles, lead to the alveoli, which are right here. When we discuss certain diseases when it comes to lungs, it really just happens here. A lot of what happens with each lung disease is very similar to one another. So now that we've got the anatomy out of the way, this is the lumen. And as you can see here, I put obstruction from conditions in the wall of lumen versus obstructions related to the loss of lung parenchyma. So now I wanted to go over some notes that I have written here. Basically going to focus on obstruction with conditions in the wall of lumen. Lung parenchyma is basically when the air spaces are filled with exudates, pus, or any cellular debris that is in consolidation of the affected part of the lung. So basically what that means is there's air spaces here are going to be filled with pus or some other sort of infections. I'm going to talk about emphysema for that. I wanted to start off with asthma. So asthma is an airway inflammation. You can see right here, this is how a normal lumen airway should look like. And then this is like a very severe airway inflammation going on. So some symptoms that happen are wheezing, shortness of breath, and cough. And we see it in children. Usually the genetic structure of the airway is usually compromised, which kind of leads to asthma. So some people are just kind of born with it. This usually has to do with your chromosome 5, 11, and 14. And if you have none of those, you could just be unlucky and have a family history of this. Now, how it happens, there's inflammation in the lumen. So now when we're looking at the how, we want to think about inflammation. Inflammation. Asthma is basically inflammation of the airway, and usually it causes the lumen to narrow and it increases mucus production. So a lot of people usually have like seasonal asthma, and usually they have to go on nebulizer. Also, environmental control. You want to make sure that you're breathing in a place where it's kind of easier to breathe. It's very light on your lungs and it's a nice environment. And also for children or maybe some young adults, you can use a small volume nebulizer. And what that basically does is that helps with breathing problems. Basically, they inhale the mist through a mask or a mouthpiece that you put on. And if it breathes correctly, it goes right into your lungs. And the machine mixing with the medicine, it turns into what we call small volume nebulizer. So that really helps your lungs. Now, chronic bronchitis, this is the second disease that you could also get. And this is basically acute inflammation of the trachea and bronchi. As you can see here, this is a trachea and it branches off into these bronchi right here. And it doesn't have a label, but you would see like the alveoli right here. Some symptoms that you have with chronic bronchitis are shortness of breath, excessive sputum, chronic cough, usually overweight patients, so the obese population, but that's not limited to those patients, and anyone really over the age of 30 or 40 years old. How this develops is because this is developed, it's usually because of an irritant like smoking or like a repeated airway infection. Usually sometimes it's just genetic. Could also inhale chemical irritants. So if you live in a place where it's not the best breathing quality, that will also not help your case. And for diagnosis, you see this chest x-ray, and this chest x-ray would basically show how a person with chronic bronchitis would be living with. This is what the doctor would see. So some treatments with chronic bronchitis is you could quit smoking. You can go on bronchodilator therapy, which will help open up your airways. And you could get proper hydration. So drinking lots of water, staying hydrated, walking on a treadmill or going for a walk outside, very light. This will help your symptoms, but you'll never fully recover from this. It's irreversible. I kind of want to shift gears into loss of lung parenchyma. And the biggest one is emphysema. Now, emphysema, a permanent enlargement, which is abnormal, of your gas exchange airways. And what that does when your gas exchanges are enlarged, it destroys your alveolar walls. Usually people that have this are from the ages of 25 to 50 years old, and this is developed, so you can also get it after 50 years old. So I really like this photo here, which depicts both chronic bronchitis and emphysema and the names that go with it. Chronic bronchitis, blue bloater, which you'll often hear. And for emphysema, it's called a pink puffer. Now you might be wondering, why are those names associated with those diseases? Well, when you think about the disease itself, it causes a person to have difficulty catching a breath. As a result, they take fast and short breaths, and that causes temporary redness and pink coloring on their cheeks and faces. So that's why it's often referred to as a pink puffer. So whenever you think of emphysema, think of pink puffer. And when you think of chronic bronchitis, you want to think of blue bloater. Now you might be wondering, why is it called a blue bloater? It's because with chronic bronchitis, the patients can have severe difficulty breathing and a decreased oxygen in the body. And when you don't have oxygen in the body, your skin and lips take on a bluish tint. So as you can see here, his lips and face is a little blue, hence blue bloater, and he's a little bit obese. So that's where the names come from. And as you can see, the symptoms are very similar. Blue bloater is just more obese and pink puffer is going to be more slender. With emphysema, they're going to have a weight loss due to a work of breathing because they're constantly fast breathing. Now, moving on from this chart, one thing I wanted to talk about from emphysema is the low anti-atrypsin lung activity that happens. Anti-atrypsin is a deficiency. It's a rare genetic disorder that is passed on from families, and it affects the lung and liver. While this condition affects the lungs, it causes emphysema. And some treatments for emphysema would be bronchodilators, again, that opens up the airways, and to stop smoking. You'll notice that with these diseases, the treatments are very, very similar with these lung diseases. It's little bits up here and there that you kind of need to grab on from each of these diseases to know what is going on, because the treatments are pretty much all going to be the same for this. So I hope you guys liked this video. I wanted to just keep it short and brief. I wanted to talk about the basic obstructive pulmonary disorders and how they happen, why they happen, how you can treat it, and this will help build your knowledge. So these are the basics. Next video, I do want to talk about the restrictive basic disorders and diseases that you could see potentially. So I really hope you guys enjoyed the video. As always, have a great day.